I'm Andy Applebaum. I'm the Chief Investigator for the REVERT study. I'm also a consultant at the Royal Devon and Exeter Hospital in the southwest of England. Hello there.
Hi.
I see from your heart tracing that you've got a condition called SVT. The REVERT trial was a randomised controlled trial to look at a method of modifying the Valsalva manoeuvre for the treatment of SVT. Asked you just to get a good seal around that with your mouth and blow hard enough to make the needle reach the target. Modification was designed to increase venous return during the relaxation phase of the manoeuvre and involved laying the patient flat and lifting their legs in the air at the end of the strain phase. Overall, we found that patients that were randomised to the standard manoeuvre, only 17% of patients were cardioverted to sinus rhythm, whereas for the modified technique, 43% of patients returned to sinus rhythm.
You're doing really well. Good stuff.
It really does demonstrate marked improvement with the modified technique. And I think we should consider using that as a standard approach to the initial treatment of this condition. 5, 4, 3, 2, 1, and just completely relax. Lift your legs up in the air. So we used a blood pressure manometer that was modified for the trial, and that can be done in emergency departments, but in other practice or usual practice, a 10 ml syringe blown just hard enough to start moving the plunger, we believe gives a similar sort of pressure. Right. So you ready? Mm-hmm. And ready, steady, blow. And the benefit of that is that patients can use this at home and outside of the hospital because it's a condition that can recur, and that gives the patient some control and may mean that patients don't need to come to hospital in the first place. Okay, and we'll sit you back up now. Okay, you feeling okay?
Yeah.
It looks like from the monitor that you've gone back to a normal rhythm. So we're just going to repeat your heart tracing and go from there.
Lovely.
Okay, great. Thanks, guys.